Welcome everyone. My name is Joanna Barr and I am a nurse educator. Today, we will explore how virtual reality VR is redefining nursing education by blending immersive learning experiences with emotional engagement. VR offers computer generated interactive environments that replicate real world clinical scenarios, making it possible for nursing students to practice skills in a safe, realistic setting. Beyond teaching technical procedures, VR's immersive designs helps with emotional engagement, which is a crucial element for building empathy and confidence in patient care. Studies show that students who are emotionally involved retain information better and develop stronger clinical skills. This presentation will walk through VR evolution, its benefits as an e-learning tool, and the role of emotional engagement in preparing well-rounded healthcare professionals. VR in healthcare education dates back to the 1990s, starting with simple two-dimensional simulations focused on basic procedural tasks. These early simulations were limited to text-based or low-fidelity graphics and lacked the interactivity needed to create an immersive experience. Students learn procedures step by step without a realistic sense of patient interaction, meaning these early tools missed the mark in developing emotional intelligence. As a result, these early VR applications were valuable for basic skills building, but could it really prepare our students for the human complexities of patient care? This initial foundation, however, set the stage for the technological advancements that followed. In the mid-2000s, the introduction of head-mounted displays, HMDs, and improved graphics increased the VR's realism, making it a more compelling e-learning tool in nursing education. This HMDs allowed students to feel present within virtual clinical environments, interacting with patients and equipment in ways that mimic, in a way, real-life scenarios. Research began comparing VR-based training with traditional methods and found that VR could enhance situational awareness and foster emotional engagement. And this was a pivotal shift, as students could now experience a closer approximation to real patient care, setting the foundation for VR as an emotionally engaging and effective e-learning tool. The 2010s brought significant advancements with improved graphics and the introduction of haptic feedback. Students could now feel physical responses like a pulse during an assessment, enhancing realism and bridging the gap between virtual and hands-on experience. VR simulation expanded to include high-risk scenarios like trauma care or critical care in the ICU, allowing students to practice critical skills in a safe yet realistic environment. And when replicating these high-stakes situations, VR was able to provide a unique opportunity for students to engage both cognitively and emotionally, which research shows strengthen learning retention and builds confidence, which are both essential combinations for future nurses. As VR evolved, the importance of emotional engagement in learning became more apparent. Emotionally charged simulations show that students retain information better and develop critical thinking skills when they connect with the material on a personal level. Educators began designing VR simulations that present not only clinical tasks but also scenarios that require empathy and decision making, such as handling difficult conversation with patients or families. When immersing students in those emotionally engaging situations, VR helps them develop the resilience and empathy needed for real world patient care. This focus on emotional engagement has made VR a powerful e learning tool that goes beyond skills building to cultivate compassionate, patient centered healthcare professionals. Modern VR simulations incorporate emotionally realistic patient interactions thanks to advancements in AI and scenario scripting. Students now interact with patients' avatars that respond with genuine emotional cues such as displaying pain, anxiety, or gratitude. These interactions challenge students to respond with empathy and care as they would with real patients. For instance, a virtual patient may show signs of distress, requiring students to comfort them while managing the clinical situation as well. This level of realism helps students practice the soft skills that are critical to nursing, fostering both empathy and confidence in providing patient-centered care. In today's nursing education, VR is an integral part of many nursing programs, enhancing traditional e-learning with immersive, experiential training that help students prepare for real-world scenarios. Ongoing research and technological innovations continue to refine VR's use in education, from AI-driven patients avatars that adjust based on students' responses to mixed reality that blends digital and physical environments. As VR continues to evolve, its ability to engage students emotionally and cognitively will deepen, ensuring that nursing programs can prepare students for both the technical and human demands of healthcare. This progress highlights the VR's potential as a long lasting and transformative e learning tool in nursing education. While already presented, VR's benefits are clear, several changes still remain. High costs can make VR technology inaccessible for some institutions, particularly those with limited resources. Technical limitations also impact VR's effectiveness, such as a lack of full body tracking, which could limit realism in physical tasks, or haptic feedback that might not yet fully replicate the feel of certain procedures. Additionally, balancing the realism of simulations with focused learning outcomes is critical, and educators must design experiences that engage students without overwhelming them. Ethical considerations also arise as simulations become more lifelike, posing questions about the psychological impact on students when dealing with some of those intense scenarios. Addressing these challenges is key to making VR more effective and widely available in nursing education. Another aspect relates to the emotional engagement and its learning impact. Creating emotionally engaging VR simulations requires thoughtful design. When incorporating interactive patient dialogues, the scenarios require ethical judgment and real-time feedback, while VR provides a comprehensive learning experience that engages students on multiple levels. Emotionally challenging simulations like supporting a grieving family or navigating a difficult ethical decision can prepare our students for the psychological aspects of nursing. Real time feedback systems will enhance this experience by guiding students' decision and helping them develop critical reflection skills. This approach ensures that VR not only teaches procedures but also cultivates empathy, resilience, and critical thinking, allowing the students to develop skills for patient centered care. We also need to talk about the technology driven feedback and reflective practice in VR simulations. Feedback and reflection are vital for making VR simulation impactful. Advanced feedback systems provide students with immediate insights, showing them the real impact of their actions and helping them adjust their approach. For example, if a student misses an emotional cue from a virtual patient, the system can highlight this and suggest alternative responses. Reflective practice is then integrated after each simulation to help students assess both their technical and emotional performance, encouraging self-awareness. When promoting continuous improvement through technology-driven feedback and reflective practices, we can help our students develop emotional intelligence and resilience, which again are so essential qualities for effective and compassionate caregivers. In conclusion, VR has proven to be more than just an e-learning tool. It is a transformative approach to nursing education. When blending realistic scenarios with emotional engagement, VR can prepare students for both the clinical and interpersonal challenges that will face in healthcare. This technology not only builds technical skills but also nurtures empathy, ethical decision making, and resilience, making sure that students are ready for the human-centered work of nursing. Moving forward, it is essential to advocate for VR's continued integration into nursing curriculum,